However, that has the unfortunate side effect that you only need 1 day to sort of plan to get high, because you just have to essentially not take the medication that 1 day. So it hasn't been quite very effective. And there's also injectable naltrexone or Vivitrol, which stays in your system for 1 month. And this sort of has the side effect where, unfortunately, if you're in a car accident or have any sort of emergency, it requires incredibly sort of high levels of opiate medication to get any sort of traction with pain control, although it is possible to do. But you know, these aren't sort of perfect solutions, but appropriate tools for some. Naltrexone, the shot, is actually also used for alcohol dependence, and studies have shown that it reduces cravings for alcohol, and that's sort of unknown why exactly that is. Antabuse for alcohol dependence is not really used terribly often anymore, because unfortunately for this one, it essentially makes you feel quite ill when you drink and then use it. Sorry, if you take it and then drink. However, unfortunately, like, you can also die, so that is not a good solution either, usually. Rimonabant for obesity is just kind of another one of these blockers. There's also a medication called Campril, which is a novel mechanism and supposedly sort of calms down some of the excitatory neurotransmitters in the brain, and there is some evidence for that being effective also. In all these medications, none of them are like a perfect solution. Most of them have like a 40 to 60% success rate at around 1 to 2 years, and patients who stop them then relapse. So you have to kind of be on them for them to be effective, which is a little bit of a duh. Like if you stop your blood pressure medication, your blood pressure goes up. Relapse, however, in this case, is often associated with increased chance of overdose and death. And then once again, I make the point about blood pressure because I thought that was a good one. So I see patients experiment with this all the time. Like if I see the blood pressure is up when I enter the room, the #1 question I ask is, did you take your medication today? And these pills, just like blood pressure medication, you know, they're not a permanent solution. It's not a cure to take a blood pressure medication. It's a strategy for changing your risk that day, essentially. And that's kind of a similar ideology. So, how long do you have to take these?